Hi everyone, I'm Dr. 𝐕𝐬𝐵𝐻𝐿aXman. I'm an orthopedic surgeon. I'm practicing since almost 15 years as of now. So my basic domain is in orthopedic surgery, as well as I'm a regenerative orthopedic surgeon, and also I practice orthopedic rheumatology. So I've been using most of the latest technologies in regenerative orthopedics from past 5 to 6 years, and have been seeing excellent results regarding the regeneration, the musculoskeletal disorders, which actually is augmenting my surgical aspect of therapies, as well as even physiotherapies and rehabilitation, which is actually improving my practice every day. QRST is a basic technology which actually stands with the technology from the German, which is called as a nuclear magnetic resonance therapy. What we understand by nuclear magnetic resonance therapy, it is basically, so if I want to explain this one, we have to go in detail about our existence, how we are existing on our planet Earth. So what's the thing which makes the life sustainability in our planet rather than any other planets? So the main factor is the magnetic field which we are living in this planet Earth. So when we see the universe, so every planet is moving in a different spin, different alignment, and different sun what they have. So our planet Earth is moving in such a way, so it actually aligns in certain magnetic field where the life sustains. Now, so when we see the universe, it's a very huge thing. When we try to break down in a smaller part, so what are the tiniest material on Earth that is called as a proton. So proton is such a way that it also spins like Earth what is spinning itself. Okay, so when the Earth magnetic field resonances with the field of the proton, then the proton cycle, the spin cycle will be much sustained, and that will be maintained to throughout its life, so that the life can arise, develop, evolve, and that is happening since so many decades or so many generations, what we are saying now. Now coming to the principles of the QRST or the nuclear magnetic resonance therapy, it actually mimics the Earth's magnetic field. So when the Earth is spinning, it has a static magnetic field so that the life is getting sustained. Now, when the aging process occurs, the cells will be degenerated or degraded. That leads to some of the conditions called as osteoarthritis, injuries to the musculoskeletal system, or the disc degeneration, so on and so forth. So what happens here, the protons are damaged and it is not emitting any kind of energy to the cell, and the cell is functioning less, or it is in a dormant state or a degenerated state, so that the musculoskeletal system is not supporting our body to perform our activities, so that we'll be getting the pain and the deformity and the disability. Now the nuclear magnetic resonance technology comes in the field. So what it says, so when the proton is spinning normally, when the proton decays its energy, the cell is activated and it will be functioning. It is in a normal tissue. So Germans, what they did around 40-45 years back, when we first invented the magnetic resonance imaging, so it was a three-dimensional imaging process where the magnetic resonance was created inside the tissue, and that field triggered to get some images to us. So it means the resonance is penetrating to the tissue. We are getting the image. So based on that technology, the NMRT, that is nuclear magnetic resonance therapeutic part of application of magnetic resonance, came into the field, and the research carried out almost more than 20-25 years, and the Germans broke through this technology, and it's been existing in our world from past 25 years, and they are successfully treating in more than 40 to 45 countries, and they have treated more than 5 to 10 lakhs of patients as of now, and most of the time it is a positive result as well. Now I'll explain about the technology. So human body is made up of hydrogen atom in abundance, because we are actually made up of more than 70 to 80% of water itself. So water contains hydrogen molecule, H2O. So hydrogen molecule is a molecule. Now when we break down, we have protons in it. So hydrogen is a proton. So proton will be spinning around its nuclei in a same axis as the Earth is spinning around its axis. So when the hydrogen atom is spinning around its cycle, the life of the cell is sustained. Now when the hydrogen atom or the hydrogen proton spinning is stopped or the spin alignment is changed, the cell will be not functioning and it will go for a degenerative disorders. When a static magnetic field is applied, example the earth magnetic field, so it is applied, the proton will be spinning in one angle and it will stop. So when we apply the magnetic resonance in 3 dimension along with the radio frequency, the alignment of the proton spin will be in line with the magnetic field. And when we stop the magnetic field, it will decay, the spin will be decayed, and that energy will be passed on to the entire surrounding tissues, and that will be retained for some quite long time. So in this way, the cell will be in a regenerative phase of its cycle and it starts developing from there on. In this mechanism, so the Germans started treating the cartilage tissues and the disc tissues where they used to give a magnetic resonance to under certain amplitude and frequency to the cells. So the cells or the atoms or the hydrogen protons which will be activated, so which will be aligned and the spinning will be retained. And when we switch off the machine, when the magnetic field is taken out, the proton spin will be decayed and the energy will be passed on to the cell or the surrounding tissue, and the regeneration process starts from there. So it is like charging our own hydrogen atoms, like charging our phone. So the charge will remain at least for 4 years. So our phone will switch off in less than 24 hours, but the cells which are being charged with the magnetic resonance in a human tissue, that will be retained for at least 4 years, depending on the age, depending on the lifestyle, and depending on the diet. So in this way, when we give a different frequency, amplitude, and energy in the magnetic field or the magnetic resonance area, the tissue which is damaged will grasp the energy as much as possible, and that will be retained and that will be sustained for next 3 to 4 years. In that verge, what will happen? The regeneration of the tissue will occur and the disability, the pain, the mobility, everything will be improvised. So this is a technology regarding the magnetic resonance therapy.